Mr. Smith is a 55-year-old male with no significant past medical history presented to the hospital with the chief complaint of shortness of breath. The patient knows that he lives an ordinary life, denies alcohol or smoking dependency. When he lays down at night, he requires a couple of pillows to sleep on so he would be able to breathe better. He also feels that he gained about 10 pounds and that he cannot fit in his shoes anymore because his legs are swollen. He denies that he's on any medications at home. Chest x-ray shows cardiomegaly and pulmonary congestion, pulmonary edema. What are your thoughts about this case? What would you like to do? What are the classic findings you see on x-ray and labs? And what labs should you see abnormal? So this is a patient who came in because he cannot lay flat at night. He feels short of breath. He can't sleep. So he puts a couple of pillows so that his body will be a little bit elevated. This patient has gained 10 pounds and he doesn't know from where. And he also feels like his legs are swollen. So on exam, this patient is going to have pitting edema. So when you press on the patient's legs, you're going to see that his legs are just kind of like a bag of water. So they're going to, your fingers are going to indent in his ankles and in his foot. And like I said, he can't breathe. The chest x-ray showed that the patient has cardiomegaly, so his heart looks big on x-ray. And also there's pulmonary congestion or pulmonary edema. And sometimes they call this the diagnosis on the chest x-ray, which is acute heart failure. So this patient has acute congestive heart failure, and this is probably an exacerbation of that. This is a very, very common admission. Again, I guarantee you're going to have this patient on your list tomorrow.